I'm Marian, and today I will be teaching my patient, Moy Moy, about how blood flows work in the heart and about a heart condition called myocardial infarction or heart attack. So here is our heart. It has 4 chambers, left and right and top and bottom. The blue marker here indicates deoxygenated blood, which the blood comes from the body and into the heart. The red marker here indicates oxygenated blood, which comes into the heart and away to the body. Deoxygenated blood from the body comes through the heart, through the superior vena cava and inferior vena cava. It comes into the right atrium, goes through the tricuspid valve and into the right ventricle. That is then pumped through the pulmonic valve into the left and right pulmonary artery. That travels to the left and right lungs. That then carries oxygen-rich blood and goes through the pulmonary veins. It comes into the left atrium, goes through the mitral valve, and goes into the left ventricle. It pumps into the aortic valve, goes through the aorta, and that blood goes through the rest of the body. Now let's talk about myocardial infarction or heart attack. This happens when one of the blood vessels that supply the heart becomes blocked, usually by a clot, and because of that, oxygen cannot reach the part of the heart muscle and it begins to get damaged. Now I'm going to ask subjective data from the patient. I'm gonna ask Moy Moy here if he feels any chest pain, about the pressure on his chest, if he can describe it for me, if it's squeezing or if it's sharp pain, and also does the pain radiates to the arm, to the legs, like anywhere in his body, if he's trouble breathing, if he's feeling dizzy, if he's tired for no reason, if also he feels like he's about to vomit, his nausea. Those are my subjective data. For the objective data, I'm going to collect all the vital signs like his temperature, his oxygen saturation, his respiration, or like the usage of accessory muscles while breathing, his blood pressure if it's low or high, his radial pulse, and I'm also going to listen for his apical pulse, or so I can detect any abnormal sounds. I'm going to listen for his heart, or check if he's sweating, any nausea or signs of restlessness, or check for his legs if it has any edema or any abnormalities of his body. If he experiences any signs and symptoms of heart attack, he should call 911 or ask someone nearby to take him to the nearest hospital so the healthcare professionals can provide immediate care and intervention for him. Thank you.